Yeah, I don't think the pandemic is over. I think we're seeing the end in sight. I think that's for sure. Again, the pandemic is officially over when you don't have more cases being sustained in the population, right? And that's where we start talking about having population herd immunity, where you just decrease the number of susceptibles in the population, so that even if people are capable of spreading the virus, there's nobody to spread it to. They're protected. So the way we get to herd immunity is through vaccination. We're not going to be able to infect everybody. We don't want that many people infected. We want to get people protected through vaccination. So we need to get the vaccination rates up. Again, California had a shaky start in getting vaccines rolled out. It was a little bit chaotic, to say, for the first couple of months, but the states really come along, and you're seeing how quickly we're moving toward full vaccination here. President Biden also doubled his expectation of the number of doses we would deliver in his first 100 days. So that's a good sign also. And that is why I think people are more optimistic right now, because they're seeing the vaccine rollout being, sort of accelerated now. And you're aware that we're going to open up the vaccination eligibility now to everybody essentially over 16 years of age come the middle of April. So that's exciting as well. So I think people are getting that perception. That being said, there's still concerns because we don't have herd immunity yet. We're not up at that 70-80% range. And as a result, people are still capable of getting infected and transmitting the virus. So the CDC, has recently released some guidelines that ease up some of the concerns and the restrictions for fully vaccinated individuals. But it's important to stay vigilant right now, mainly because there are vaccine breakthrough cases. Nobody said the vaccine was 100% effective. In fact, the efficacy was on the order of 95% when they did the clinical trials. And when you distribute the vaccines out to the real world, they're probably on the order of 90 to 92%. So that means that maybe one out of 12 people, one out of 10 people possibly might still be able to get infected with the virus. It's pretty clear that if you were fully vaccinated and you get infected, the likelihood of you having very serious disease or dying is extremely low. So that's a good thing. We're protected. But that doesn't mean you can't transmit the virus to somebody else. And the data that gives us some indication that you're not capable of being a carrier if you're vaccinated is emerging. I think in the next couple months, for example, Israel, who's vaccinated such a large portion of their population, they're going to be able to answer that question, whether or not people that are vaccinated are really capable of being carriers and spreading it to other people. The likelihood is that they're not, but we don't have that evidence yet. So we have to still remain vigilant. We still have to do all of the standard safety things, which is masking, social distancing, trying to prefer outdoor venues instead of indoor. All those things really have to be maintained until we get to a point where we're comfortable that we're not seeing new transmission happening in the population.
So is it possible that it could get any worse, right? Come a fourth wave, for instance?
It is absolutely possible for a fourth wave. And again, remember, we don't have the majority of people vaccinated, right? We're in California, we're in the 25, 27% range. Other parts of the country may be different. But you saw some examples in Miami Beach with spring break folks where high density, no masks, huge chance for more transmission. And that is the case that we're living with right now, because the majority of people are not vaccinated or have not had an infection themselves. We still have a huge proportion of the population that are susceptible. And as long as you have susceptibles and there's some virus in the community, you can get that spread. So that's why we have to remain vigilant. We want to try to avoid a fourth wave. The other thing I'll say about the waves, again, and the surge is, like they say, all politics are local, all epidemics are local. So it is possible that you will see parts of the country that will have a much higher incidence now of new infection. And that would be places in New York, New Jersey, other parts of the country. So they may actually experience a fourth surge. And in California, if we keep up what we're doing and remain vigilant, we may not have that at all. So again, it doesn't mean that there's a fourth wave that hits every part of the country or every part of the globe. We have to look at our local situation and sort of plan accordingly. Yeah, so my outlook at this point is very positive. I think we're moving forward quickly with the vaccination. That's very important. We do know that we can control risk with some of our behaviors. So if we're smart about things and people kind of adhere to the non-pharmacologic interventions that we know that work, that combined with a really fastly increasing vaccination rate, I think puts us in very good position to be out of this. And, I'm looking at, hopefully late fall, but certainly by the end of the calendar year, I think we will be getting back to a much more normal state. At that point, I mean, again, we have to get that herd immunity up to a high proportion of the population so that we don't have to worry about it anymore. And then even at that, there are concerns about traveling globally. A lot of us, I do global health, and so all of that travel has been curtailed. Travel is one way that we've seen how the pandemic emerged originally, going from China to Italy, for example, in the early days. It doesn't take too many people getting on airplanes that have the virus to sort of kind of reignite things. So that's why it's so important that we get the people protected by vaccination, so we don't just have that fuel sitting around there for a spark to kick it off. No, I think from the perspective of health professionals now, we really are hopefully going to see the end to this pandemic. The other thing that's really important is we've learned a lot. We've learned a lot about how to handle the situation. We're hoping that we won't have a repeat. We'll be much better prepared next time around. I think a lot of the public health infrastructure that's been eroding for the last 20 or 30 years, we're going to probably get a reversal of that. There's just been a constant erosion, and through both Republican and Democratic administrations. So now that we got caught, I think we'll be better prepared. So we're excited about that. There's going to be a big demand, and we're already seeing this now for people to get training in public health. We had double the number of applications to our Masters of Public Health program this year, so that's very encouraging. And I think the government, both federal government as well as state and local, they're looking now to hire more people, to have better surveillance in place. And the other thing, just think about the medical breakthroughs here. The fact that we had multiple vaccines developed within a year. I mean, that was unheard of before. And that has a lot to do with our biomedical science capabilities now. We just know a lot more. So I think that the future is much brighter. But this was a horrible lesson at an incredible cost, thinking about in this country, over 550,000 deaths related to this virus. So, we will have to be much better prepared next time.